Are you struggling to find a comfortable sleep position due to sciatica pain? Are you tired of tossing and turning every night, desperately searching for a sleep position that doesn't aggravate your sciatica? The pain shooting down your leg, the discomfort in your lower back, it's enough to make anyone dread bedtime. But here's a little secret. The way you sleep could be the very thing that's making your pain worse. It's time to change that. In this video, I'll uncover the do's and don'ts of finding a great sleep position in bed if you're suffering from sciatica. I'll show you a few simple adjustments like the strategic placement of pillows that can drastically reduce your pain. You'll learn the exact positions that are best for your spine and your sciatica and how to make every minute of your sleep count towards recovery. And that's not all. Towards the end of the video, I'm going to share a bonus tip, my top recommended stretch to do what's right when you wake up. This isn't just a stretch, it's specifically designed to reduce sciatica pain and improve mobility, setting you up for a pain-free, productive day. Trust me, you don't want to miss this. Hi, I'm Dr. Raminder Burke, a chiropractor in Woodbridge, Ontario, Canada. We have helped thousands of patients recover from spinal conditions such as disc bulges, herniations, degeneration, lumbar stenosis, sciatica, and radiculopathy. We use non-surgical spinal decompression as the cornerstone of our unique and proven back-to-life method. Be sure to hit that subscribe button if you want do-it-yourself tips, strategies, and exercises that will help you relieve and manage your back and leg pain at home. Plus, you will discover which therapies are best for treating disc bulges, disc herniations, and other spinal degenerative conditions. I'll upload a new video every week. In addition to that, I wrote a book called Back to Life. Imagine getting your life back while getting your health back. You can get a free copy in the link in the pinned comment below. So the first thing to understand is the anatomy is very important on how you place yourself to sleep, because obviously depending on which position you're in, this is going to stress the lower back anatomy, right? So we have our pelvis, we have our sacrum and the vertebrae, and obviously when we have a bulging or herniated disc, that's going to come out between these vertebral bodies. So as you position yourself at sleep, it's going to determine how much stress you place on those nerve roots that then form a bundle. So we have each nerve root at the spine combines to form a larger branch called the sciatic nerve, and as that travels down the leg, obviously the worse it goes as it goes further down the leg. So we want to really determine sleeping positions that relieve that sciatica caused by the irritation of this sciatic nerve. It can lead to sharp pain, tingling, and numbness that often worsens at night. So as you try to sleep, increased pressure on the lower back can aggravate this nerve, resulting in disrupted sleep. This lack of quality rest affects overall well-being, leading to fatigue, irritability, and reduced focus. So as we get into the common mistakes in these sleeping positions that worsen pain, and then how to correct that next. Many people unknowingly worsen their sciatica pain by choosing the wrong sleep position. Now, the first one, an obvious one that's not great for your spine, is when we lie down on our stomach, right? So we're lying down, we're finding that our neck is cranked to one side or the other. This is going to put a lot of stress at the neck, and then of course that travels down the spine. So most people's positions that crank on their neck are half of the problem. When your problem is traveling down your spine, and now we're arching, we're finding that your lower back is arched, your lower back is stressed, the muscles get compressed and tighter by lying on your stomach like this. So always avoid lying on your stomach. When I get into good positions, two positions that are great, lying on your side, right? We want to have a pillow. We have a great pillow that I recommend made out of buckwheat husks. So this pillow can conform, get into your neck curvature, supporting your posture neutrally in your neck, first of all. And then what we can do is from there, take a second pillow and put it between the knees. So as you have that there, you're finding that your spine is perfectly aligned all the way down. So keeping your hips separated, your knees and pelvis stay in better alignment, relaxing your lower back, and we're lying on our shoulder comfortably so you get a good sleep position from here. So that's the one I recommend. Secondly, the other way that's ideal. So the best sleep position is going to be on our back. So here we're using the same pillow to support the curve. As you see, the husks inside here really conform to the curve of my neck. So as I'm doing that, I'm in a nice, completely neutral spine. My pelvis is slightly tilted back, which takes out the stress in my lower back muscles. It can actually give them a light stretch. So as we do this, you can combine 1 or 2 pillows. So as you raise that height of your pelvis, it really relaxes the core and your back and just gives you that perfect spinal support. So lying in this position is going to give you the most relief and long-term effects on your sleep, of your sciatica, and your conditions that really prevent you from aggravating it in the middle of the night. Next, we're going to go into what other things that can really help in addition to keeping a good sleep posture. So the first and most important additional tip we're going to give you is, obviously you've been lying in bed with the pillows, whether it's under your knees or on your side. Now, how are you going to get up so you don't aggravate everything? The worst way to do this is just come right up, right? So when you crunch and you have to stress your spine, whether you twist, obviously that's going to add stress to your spine suddenly in the morning when your muscles aren't even ready. So if you're going to do the bonus stretching we're going to give you at the end, after you've done that, we're going to get up in a position that's whether from your back or you're already on your side, you're going to turn. So you're going to turn from your side, and this is how we get all our patients off our therapy tables. You're going to bring your legs down as you push up with your arms. So using your elbows, using your arms is going to take the stress off your back, bringing your legs down at the same time. Kind of helps gravity work with you instead of trying to force yourself out of bed. So that's the first and most important tip. The few other tips that I tell everyone is making sure you're getting hydrated during the day is going to help you have a restful sleep at night. Taking magnesium is another supplement that I highly recommend. So I recommend 2 in the morning and 2 right before bed. Those 300 milligrams twice a day are going to really help with relaxation, muscle tone, less cramping at night in your legs. So if you're noticing you're having cramping, magnesium can be a big factor in that. Some of the other key little habits that you're going to create: don't eat at least 3 hours before you go to bed. So that's going to help your body digest food prior to getting into bed, and people find they sleep much, much better by not eating close to bedtime. Some of the other things we can do is take a tablespoon of honey, which gives your liver some fuel to sleep better through the night. We find reducing your exposure to electronics, so blue light, which is what they're emitting, TV screens, phones, those are the things that we want to avoid. So I actually use red lights and turn on red lights so we avoid just white light in our times before going to sleep. So some of those things are little factors that can help. Installing blackout curtains is another trick. And some of the most important things are obviously going to be the main things that we sleep on. So a pillow, a great pillow like the one I'm explaining. This one is a buckwheat husk back to life pillow that we use because it's very moldable for all purposes in bed. Some of the things people ask me all the time about mattress wise, I always recommend going on the side of firm mattresses, but getting a 2-inch memory foam topper. So that little topper is going to give you that cushion, but having that firm support underneath to give your spine the support it needs as you sleep throughout the night, getting into your stretches, getting up out of the bed. So a combination of using these tactics are going to help you get the best sleep when it comes to sciatica and getting on with your morning throughout the day. Now here's your bonus exercise tip. Start your day right with these easy, effective stretches designed to improve mobility and reduce sciatica pain. By incorporating these gentle movements into your morning routine, you can help alleviate tension in your lower back and legs, setting you up for a pain-free, productive day. So the first and simplest thing we're going to do, getting up out of bed, obviously, first thing we're going to be lying on our back, and we're going to start with some simple stretches to just create movement in our hips and pelvis. So the first thing, starting with this position, is just a 1 knee to the chest. Holding this for 15 to 20 seconds aside, you're going to repeat both sides 3 to 4 times. Real easy, just feel that stretch. As you get more comfortable, pull a little closer and go deeper into the stretch. At that point, when you've done 2 or 3 aside, I want you to bring both up, holding the knees towards your chest for another 15 to 30 seconds, and you're going to repeat that 3 times. Sometimes what I like to do is just curl up into it a little bit so you feel a stretch all the way through your neck and lower back. And then the third part of this is going to be windshield wipers. We're just going to give a nice, easy pelvis tilt rotation, left and right, creating some mobility in our pelvis. A lot of people with sciatica are going to feel this right in the lower back, so don't force it, but just gradually increase the distance from left to right. So this windshield wiper gets the sides and the elements in the pelvis and upper thoracic spine moving. From there, it's a real easy getting up, as we talked about, coming up, and then you can get up from there, or I like to incorporate a simple stretch, just putting your foot on the other knee, holding, just arching your back, or giving it a light pressure. From there, back and forth a few times, and bend forward into that stretch to give the lower back a deeper stretch, and repeat each side 2 to 3 times. That'll get you started, getting on with your day. Getting your sciatica warmed up and getting the body moving is very crucial on how the day will go from there. Don't let sciatica pain take over your nights and rob you of restful sleep. By trying the pillow hacks and incorporating the simple exercise I just showed you, you can take control of your sleep and wake up feeling refreshed and pain-free. Give these tips a try and experience the difference for yourself. Remember, a good night's sleep is not just in a dream, it's within your reach. Now, I want to hear from you. After you've tried these tips, come back and leave a comment. Let me know which tip gave you more relief, the pillow hack, or the stretches. Leave a comment and let me know. And if you found these tips helped you ease your sciatica leg pain, please like and share this video. It helps others who could benefit from these strategies find this video more easily. If you're looking for more great exercises, stretches for sciatica that you can do throughout the day, go watch the next video here where I show you 4 best sciatica exercises for fast relief of sciatica pain. Go watch that video now.